Mucormycosis or black fungus is one of the most searched topic these days. In this video, I will try to cover most of the important questions related to mucormycosis. Hello my dear friends, I am Poonam and you are watching Biology Explained. The first and most obvious questions that come to our mind is, what is mucormycosis? Mucormycosis is a fungal infection which is caused by a group of mold called Mucormycitis. It can affect our face and brain, lungs, gastrointestinal tract, skin and even blood. How common is mucormycosis? Mucormycosis, also informally known as black fungus disease, is very uncommon. Although the fungus is present almost everywhere in air, soil, dead fruit, vegetables, dung, it is not a common infection. Our immune system is very much efficient in handling this fungal infection. Who are most vulnerable to this infection? Most of the common people would not get this infection. However, if a person is immunocompromised due to uncontrolled diabetes, prolonged use of steroid, cancer, HIV, organ transplant, taking chemotherapy treatment, this group of people are most affected by mucormycosis. Why COVID-19 patients are having mucormycosis post-COVID infection? We have to understand that this black fungus is an opportunistic pathogen. That is, whenever it finds a chance to infect, it will do it immediately. Now, in case of COVID patients, steroids are recommended by doctors. Although steroid is very important for COVID patient, it should be given with lot of caution. The steroids suppress our immune system and it increases the blood sugar level. And these two aspects gives the black fungus a chance to invade the host. Moreover, in case of severe COVID-19, ferritin increases and this fungus is known to feed on ferritin. So this might also be a cause. Another reason for mucormycosis occurrence in COVID-19 patients may be use of unhygienic oxygen masks and tubes, which become moist and are not cleaned. As a result, it gives the fungus a pretty good chance to grow over there. Does it occur only in COVID-19 patients? The answer is no. Doctors know about mucormycosis from long time, but it is not a very common disease. So it is not known by common people so much. Are people with thyroid disorder more vulnerable to mucormycosis? Again, the answer is no. There is no study till date which says that people with thyroid disorder are more vulnerable to mucormycosis. The drugs used to treat thyroid disorder do not change or do not weaken our immune system. So in general, thyroid disorder do not make one more vulnerable to mucormycosis. However, if someone is on high dose of steroid medication, like people with thyroid eye disease, then they may be immunocompromised and thus vulnerable. Is mucormycosis lethal? Although it is an uncommon disease, but mucormycosis is pretty much lethal. Mortality rate is 50% even after treatment. That is, 50% of the people die if they contract mucormycosis. However, if detected early, it can be cured. What are the symptoms of mucormycosis? In case of COVID-19 patients, two most common mucormycosis are rhinocerebral mucormycosis and pulmonary mucormycosis. Early signs of rhinocerebral mucormycosis are sinus pain or blockage at one side of the face, one-sided headache, facial deformity, swelling of the eye, vision distortion, blackening of tissue on nose, cheeks, black discharge from the nose, black lesions inside the mouth palate. Pulmonary mucormycosis, which happens in lungs, is more difficult to diagnose because it does not have any specific symptoms. Fever, cough, chest pain, difficulty in breathing, blood while coughing are some of the common symptoms with pulmonary mucormycosis. What are the treatment options? Treating the fungi is very difficult. Early treatment with liposomal amphotericin B for 4 to 6 weeks might be helpful. However, please remember, self-medication is big no-no. You are supposed to consult your doctor and start the treatment. In most of the cases, surgery is required to take off the fungus ball completely. Sometimes organs like eye need to be taken off as well. How to avoid contracting mucormycosis? As I have told earlier, it is found in air, soil, plants, decaying fruits and vegetables, and even in the cow dung and other dungs. So it is very important to wear a mask at least 15 to 20 days post-COVID infection so that you don't breathe it. Avoid touching soil, plants, etc. for 15 to 20 days post-COVID. And in general, if you have to work with soil, dead food, etc., please wear masks, cover hands with full sleeve dresses, full trousers, have a very hard shoe, and wash your hand once you are done. Don't touch your face, nose, eye with your dirty hands. Keep proper hygiene. That's it for today, guys. If you found this video informative, don't forget to hit the like button and subscribe my channel for more such videos. Thank you.